Colette, I think the one important thing about the data, when you talk about HTCs have to be willing to share that data, you're not asking them to share it with NHF. You're asking them to share it with the payers. And I think that's what kind of sets this apart from, even the Alliance PPO network, is that this data is not being shared with anyone but you and the payer, where that relationship should exist.
Right.
You're just
what we've ever asked for is de-identified aggregated. So if the payer has, let's say 10 members in it, and they're in different states or different HTCs, like the work we did, the pilot we did back for one of the TPAs for one of the jumbo health plans in the country, I won't name, but we got the de-identified data so that we could promote the findings. Because how can we promote the findings if we don't have aggregate de-identified data? I don't want patient level data. I don't want to be responsible for it. I don't want any part of it. When these kind of center of excellence models started popping up, and Walmart was a leader in that area, when they said any Walmart associate needing open heart surgery, they had two options in their plan. One, they and a loved one would be flown to Cleveland Clinic, all expenses paid, no out of pocket, airfare, food, hotel, surgery, the whole shebang, and care. Or option two, they could get their surgery locally, but there was a significant out-of-pocket burden to do so, right? So obviously it incentivized patients to use the center of excellence model, the Cleveland Clinic. And in a couple of years worth of pilot data, what that showed is that 20-some% of the patients didn't even need open heart surgery that went to Cleveland Clinic, right? Because these patients are coming from rural areas all over the country. And the cost of care was significantly increased. So what I don't want is for there to be a handful of HTCs that step up and do the right thing. I tell everyone all the time, I mean, I obviously brag about BCDI, I brag about you, Jennifer, I brag about Gulf States, Indiana, but it can't be that a handful of them do it right and then these self-funded employers want to try to drive patients just to those center of excellence. I want patients to stay in their community and go to their experts that are managing their care there locally. We just have to communicate what we're doing and let them know that they don't have to do it, but if they don't do it, they're not going to be in the network. And if they're not in the network, the programs, how do they sustain themselves? I mean, that's really the bottom line.